excuse me, privileges of the floor. Privileges of the floor. Senator De Leon.
Thank you, Madam President. Colleagues, we're going to have in a few moments a very big bill that is before us, hence, all the cameras. I wish they were here for us individually, but obviously they're here for a very important measure that will be before us, and we'll have a very vigorous debate. But before we get there, I'd like to just introduce three individuals from Cristo High School in Sacramento. The reason why is that they have given their valuable time in the past 3 years as well as 2 years after school, almost every single day, coming to the state capitol. They've been invisible, but they've been working in this institution, helping to move this engine forward. They're all graduating from high school. All of them are going to a 4-year university, and they are here today with their families. First, Ulises Ponce Gutierrez. Ulises will be attending Sacramento State University. He's the oldest of 4 children and will be the first person in his family to attend college. Second is Karime Sanchez. She will be attending Holy Names University, and she's also the first person in her family to attend college. And lastly, we have Milan Leathers. Milan will be attending UC Berkeley down the I-80 in the fall. She's the valedictorian of her class. These are interns who have worked countless hours. They've been invisible to many of the folks here, but trust me, their hard work has really helped push this Senate institution forward. With that, let's give a special recognition to these three.
A warm round of applause
on their way.
For these outstanding young people. And thank you for giving us hope for the future. All right, colleagues, it's now time to turn to file item 44. This is the time certain for this measure. File item 44. Mr. Secretary, please read.
Senate Bill 128 by Senator Wolk, an act relating to end of life.
Senator Wolk.
Thank you, Madam President. I'm proud to jointly author SB 128 with my colleague and friend, the Senator from Monterey County. Madam President, I will open, and my colleague, the Senator from Monterey County, will sum up at the end. The last speaker will be the President Pro Tem, and then I will close. SB 128 is about how we die in California. Not an easy conversation to have. But death comes to all of us. We prefer not to think about it. But if we do, we might prefer to die in our homes at a ripe old age with no lingering illness or trauma after a full and rich life surrounded by our friends and family. But for many, the end comes in a very different way. There can be terrible pain and suffering. There can be an agonizing descent into physical and mental deterioration. And many of us have experienced this trauma with friends, dear friends, or very close relatives. Many of you have these stories to tell, and you shared them with us, and we're grateful for that. My own story is not unique. I was 17 when my vibrant young mother ended a 3-year struggle with metastatic cancer, and it was frankly brutal. Sometimes the pain could be controlled, but other times it could not. Her suffering was prolonged and unbearable for her, certainly also for her family. And we all know the story of Brittany Menard, the 28-year-old who was diagnosed with a glioblastoma, a brain tumor, awful one, who had to leave this state in order to find peace. It does not have to be this way. It does not have to be this way. 128 would establish the End-of-Life Option Act in California. And this law would give California adult residents who are in the end stages of terminal disease and are capable of making medical decisions, the option to get a prescription from their doctor for aid in dying medication that will allow them to voluntarily end their lives in peace. 2 independent physicians must confirm the diagnosis and the prognosis. There must be 2 verbal and 1 written request that is witnessed by 2 people. There is a waiting period of 15 days that must pass before the doctor writes a prescription. Consultations and requests, if they're in a language other than English, must be verified through official translators. This practice, which is called aid in dying, currently is recognized in other states. It has been in existence for 17 years in Oregon, for 6 in the state of Washington, and now Vermont, Montana, and New Mexico also support this concept, this approach. There's been a dramatic change in public opinion. Most Californians now support this approach. And a major reason for this change in public opinion is that we have 17 years of experience, of data and research. 128 will have the same data gathering and research. The fears of the opponents 17 years ago in Oregon and current opponents to this legislation have not materialized. They said there would be abuse or coercion of the elderly or the disabled. There would be neglect by unscrupulous health plans, by unscrupulous caregivers, or that religious hospitals would be forced to participate. All that has proven to be unfounded. There has been no documented abuse or lawsuit resulting from this law. 17 years. At the same time, there has been no rush to die in Oregon. In the 17 years that the law has been in effect, there have been 1,327 patients have obtained the prescription, but not all use it. 35% did not use it. Simply having the prescription is in itself a source of relief, knowing that if things got really bad, that one had an option to end one's life with less suffering and in peace. 90% of that 1,300 are in hospice. This law has worked so well without abuse or lawsuit because of the comprehensive safeguards and assurances that are built into the Oregon, Washington, and Vermont laws, and our bill will have these safeguards and more. And there are 2 categories of those. The first will be protection for the patients, and then the second are protections and assurances for the healthcare providers. First, let me talk about protections for the patient. 2 independent physicians must verify that this is end-stage terminal illness. And this is really the heart of this bill. A person must have the capacity to make medical decisions as judged by the 2 independent physicians And if there is any doubt, there must be a referral to a psychiatrist or a psychologist. In this area, the CMA language, the California Medical Association's language, was very helpful, and you can read it on pages 4 and 5. With respect to the developmentally disabled, the Alzheimer's patient, or the dementia patient, it's the ability to make medical decisions that is critical. There is a 15-day waiting period before a prescription can be written. Old age, explicitly in the bill, old age, doesn't say old, just age, cannot be a criteria, a sole criteria for participating in this bill, for using the bill. End-stage terminal illness is the criteria. Disability alone cannot be a criteria either. End-stage terminal illness and the ability, the capacity to make medical decisions. Participation is voluntary. There is continuing attention through the entire process to evidence of coercion, to physicians, the two witnesses. No one other than the individual can request the use of this bill. No conservator can do that, no guardian, no power of attorney, no advance directive, no medical agent may request to use this law for someone else. There are felony penalties in our bill for coercion, exercising undue influence, and for altering or forging a prescription. Before a prescription is written, there must be, it is mandatory, that there be a discussion of alternatives, including treatment, further treatment, palliative care, the hospice opportunity, the option of changing one's mind at any time. In the bill, there is over a page, and I encourage you to take a look at that, prescribing what happens at that last conversation, and it is fairly thorough. That last conversation has to be a private meeting. It is required to be private between the physician and the patient. A translator can be included, obviously, to confirm once again that there is no coercion. The drug must be self-administered and ingested. The words are in the bill, the ability, it must be affirmative, it must be an affirmative, conscious act. Again, working with the California Medical Association was very helpful in really zeroing in on these protections. For the family and patients, it is important to note that using or not using the law should have no effect on your health plan benefits, your rates. We are explicit in the language. Health plan benefits rates cannot be affected by participating or not participating in the law. Neither can accident rates, life insurance, annuity payments, or rates be affected by participating or not participating in the law. Now let me go to the protections and insurances for the healthcare provider. Now, provider is defined, as it is in California law, the full range of healthcare providers: doctors, nurses, I'm not going to list all of them, doctors, nurses, pharmacists, hospitals, clinics, etc. No health provider bears any civil or criminal liability or is subject to disciplinary action for using or not using the law. No sanction of a healthcare provider who is unwilling or unable by ethics or religious belief to participate in this law can occur. We are not interested in changing the philosophy or the doctrine that governs any doctor or individual or religious hospital. This is truly voluntary. And that's why the CMA, the pharmacists, the CHA have either removed opposition or remained neutral, but they have generously provided guidance to us to make sure that the language reflects that intention. To close, I would just like to say that my colleague and I would request your aye vote. We think it's time to bring this option to California. It is the humane option. Thank you.
Thank you, Senator Wolk. Is there debate or discussion? Debate or discussion? Senator Morlock, filed by Senator Morell and Senator Allen and Senator Vidak.
Thank you, Madam President. I was born in the Netherlands, so this subject is not new to me. It was actually proposed more than 80 years ago by the country next door, which would later occupy the Netherlands. So it's not a new subject, but I would also remind everyone that in Holland, they have socialized medicine. I won't even get into that subject today, but I just find it interesting being new here, enjoying week 11, that we've decided that parents are thwarted on the ability to have a choice on vaccinations for their children. But we're considering today the ability for their parents to have a choice on what I would call the ultimate vaccination. Giving their parents a chance to abandon their kids, their grandkids, and maybe even their great-grandkids. I find this very baffling. I call it assisted suicide. For me, it's unconscionable, and colleagues, I can't be party to it. It harkens back to a question we had earlier this week. What kind of society are we? And I don't believe we're in a disposable one when it comes to shortcutting the natural course of life. Colleagues, I urge a no vote on SB 128.
Senator Morell.
Well, thank you, Madam President, and members. This issue we're debating is a serious one, and I certainly do not wish to minimize the pain experienced by families who watch their loved ones suffer. But suffering in this present life is often odd, perplexing, and even contradictory. I know I certainly don't want to suffer, and I'd hate to see any of my family members suffer, especially my children, you know? I don't think any of us here would. But C.S. Lewis does talk in his book, The Problem with Pain is it's part of life. And it's interesting because some of the history's greatest thinkers with wisdom superior to mine, from St. Francis to Thomas Aquinas, Augustine, and others, instruct us that through loss, tragedy, and pain often extends hope to others and reinforces that life is a privilege extended to us by the giver of life who prepares us for eternal hope. And in today, our younger generations have often been called the generation who has lost hope because of the financial problems they see in America, but also, I think, other things too. And so these great thinkers recognize that every person has two qualities, and that's the physical and the interior condition of our soul. One story I'd like to share is about a young girl, you may have saw her on 60 Minutes, who was diagnosed with cancer and given 2 months to live, and her face swelled up, but she desired to contribute to her basketball team at Mount St. Joseph University. Sick, weak, with a swollen face, she made it to her first game, played, and was even fortunate to score 1 basket. In fact, basketball legend and star LeBron James wrote that perhaps she was the biggest inspiration that he had ever experienced. Same is true with the 10,000 people that showed up and sold out that gym because they wanted hope and encouragement themselves in such a negative world. And I think about my own father, who was 6'1", weighed 210 pounds. It was pretty darn tough being a LA policeman, but I watched his body deteriorate over about a year to 97 pounds with cancer. But you know, he valued life and was such a good example of me to just fight on despite these challenges. And I certainly have walked with him during those days, which was very tough. So I just think that people could choose to die because they fear that they are burdens today. Society places this on many of us, I think. But where is our compassion and our commitment, as the marriage vow talks about, through good times, bad, and through sickness and through health? We cannot allow individuals in such vulnerable circumstances to feel like it is their duty to die. Every human being has intrinsic dignity and immeasurable worth. Patients at the end of their lives need care, not tools to end their lives. With too many young people today attempting to take their own lives each year, it's become an epidemic. And we're here, perhaps sending a signal that suicide may seem okay. As society moves towards relativism, we are slowly becoming a culture that devalues life. This body should not attempt to give something that is not ours to give, and that's the power over life and death. Attorney Margaret Dorr of Seattle recounted stories of families she's worked with traumatized and victims considering whether or not to go through with that final lethal dose. They experience this, I believe, because they are attempting to make a decision that human beings were never designed to make. In one state, there has been examples of insurance plans denying chemotherapy to one cancer patient and listing physician-assisted suicide as an option. And I do understand as medical systems become too impactive, with cost containment will become a factor in these decisions. But I ask you, is life not worth more than money? Life is a gift and is a privilege, and it should be protected from the beginning to the end. Therefore, I ask you and urge you to vote no on SB 128. Thank you.
Senator Allen.
Well, let me just start by saying how difficult it was for me to hear the example of the Netherlands' neighbor brought up in the context of this conversation when the lives taken by that regime were taken with absolutely no choice on the part of the people who were killed. That was very difficult for me to hear. The other thing I will say, that the equation, the confusion of life-saving vaccines with this issue was also very difficult for me to hear, and I would suggest inappropriate, and I say that with the greatest amount of respect for my friend. So let me begin with my prepared remarks, and that's to say that consideration of this act places a very profound and important question before us that we've all been discussing. What should the role of the government be when an individual is confronted with a terminal diagnosis, when death is inevitable and imminent? Now, like many of you, in seeking an answer, I sought the counsel not only of policy experts, but also of spiritual and religious leaders, and I spoke with a number of ethicists who wrestle with and provide comfort and solace to all of us struggling to live and die with both purpose and with dignity. I've spoken with leaders who hold deep convictions about the sanctity of life and have, I think, very sincere fears that SB 128 erodes this principle in a dark and irreversible way. And I feel that I owe it to them and to their followers and many of their congregants to explain why, with the utmost of respect and after careful reflection, I will be supporting this bill before us today. Now, as you've heard, this bill is based on an Oregon law that's been on the books for more than 17 years. Medical aid in dying is now also permitted in Washington, in Montana, and Vermont, and New Mexico. There are safeguards in place in these states, and Senators the authors have not only replicated, but built upon them. They are designed to ensure that a Californian making the request for an aid in dying drug does so voluntarily, and that he or she has the mental capacity to make that request and is not suffering from impaired judgment. The request must be witnessed, made multiple times over multiple occasions, and can, of course, be revoked at any time. As a crucial safeguard, once a drug is prescribed, it's incumbent upon the patient to obtain and ultimately self-administer the dosage. It's the choice. Now, just as important, this bill specifies that no healthcare provider, no doctor, no hospital can be required to participate in or otherwise facilitate the provisions of this act. They are as free as a patient is and are protected by the law's provisions to take no part in its administration if they object in any way for reasons of conscience, morality, or ethics. We as a state and as a society may have disagreements over when and how a terminally ill Californian's life should end, but if this bill becomes the law, only those who voluntarily elect to participate in its provisions will play any role. Now, I must say that I continue to receive suggested improvements from folks in my district and elsewhere, and it's very important to me, and I say this to the authors, it's important to me that they continue to engage with stakeholders, to continue to consider whether the safeguards in this bill can be made even stronger so that we ultimately ensure that absolutely only terminally ill Californians of sound mind and judgment who are free of coercion, absolutely free of coercion, will be able to utilize this method under the law. Now, I'm not qualified to say exactly what is a life well lived and a death well met. I don't think it's the role of government to say so either. Each person must find his or her own answer to that question and act according to their belief and ethics. I have an enduring respect for the religious leaders I've spoken to who oppose this bill, but I choose to support it because I don't think that any faith under our Constitution should dictate the time and manner of how a terminally ill Californian may die. Thank you.
Thank you. Our next speaker, Senator Vidak.
Madam President, fellow senators, while others may discuss the global, religious, legal, and moral issues surrounding this end-of-life prescription, I have a few specific concerns myself. I will agree with most of the religious views, but I've got three concerns that I have with the bill in addition to those. It was mentioned that this may be around for 3 years in a home. Number one is the safety of our children around this prescription. We require guns stored in a household with children be kept in a gun safe, a lockbox, or disabled with trigger locks. Failure to follow this safety law could bring convictions of first or second degree criminal storage of firearm convictions. I can't find in this measure that same stringent safety requirement for keeping this pill away from children. Number two, along the same lines, would be theft of this prescription. When we're broken into in our homes, many go straight for the jewelry, the cash, but they go straight to the medicine cabinets. This, again, can bring negligence charges if you're a gun owner, and what the perpetrator does later with an illegal obtained weapon. I can't find the safety measure for a theft of this, nor protection of our children. And then thirdly, and I'm having a hard time with this one also, this prescription is humane for family members. But just yesterday, there was a story about our state settling a lawsuit about the complicated drug protocol for executing prisoners. But we know that approval of executions using the new formula will take several years, if ever. So this prescription is humane enough for a loved one, yet isn't humane enough to be used to execute a mass murderer like Charles Ng or a psychopath like Scott Peterson? At this point, I have too many unanswered questions, and I urge your no vote.
Senator Hernandez.
Thank you, Madam President, members. First of all, let me first start off by thanking the author for bringing this issue forward and the joint author. As you know, I'm one of the co-authors, and obviously I stand here in support of the issue. This is a very, very emotional one. It's one that we all are going to be dealing with, unfortunately, someday, and we're all going to die. I had some prepared statements, and I'll probably refer to them, but I'd like to just talk a little bit about if it were me and talk about what my choices would be. So I have an incredible family. I have a wonderful wife. Fortunately, my parents are still alive. I have 2 beautiful children. And I would think that my children, my wife, and my mom and parents and my dad would never want to see me die. And of course, I don't want to die, but I know that someday I'm going to have to. So here's how I kind of look at this. God forbid, if I were stricken with a devastating terminal illness that I knew it was inevitable, that I was going to be dying, and I was in such bad pain, I at least would want to have the option. That doesn't mean I'm going to act on it. And as you can recall from the opening statements, there are many safeguards from 2 physicians, mental capacity, you had to have the 15-day waiting period, et cetera, et cetera. But for me, I would want to at least have that choice. But here's what would play in my mind is the choice that I would want to have if it got so unbearable is the choice that I would not want to have my family see me suffer anymore, knowing that it's the end. Now, of course, we all want to live as long as we possibly can, but for me, it comes down to personal choice. And so that's why I stand in support of the issue. But we also looked at the Oregon and Washington's data and evidence that shows that this option is sparingly used in a safe manner, and all Californians should have the option together with their families and their doctors to make an end-of-life decision that are right for them in the final stages of any terminal disease. This bill will provide an additional option in the range of end-of-life care decisions available to those in the final stages of a terminal disease, which can include additional treatments, pain management, comfort care, and hospice. But I would like to say that, there have been some concerns brought up, and what's interesting about our political process, and there's some very interesting concerns that were brought up that I'm now of concern as myself, and maybe the author can look at it. How are we going to address the safety issue of children? What happens if somebody breaks in? But I think that's something that we as a deliberative body have to continue to look at. But I stand here in support of the issue.